Hi, namaste. Welcome back to Yoga Therapy with Madhu. Today I'm going to show you a simple therapeutic tool that you can use if you're suffering from chronic back pain. Also, if you're somebody who's sedentary and you are in a desk job and you don't move all day, this can help with reducing that back pain, like I said, and also for spinal mobility. I'm going to show this pose in couple of variations. So standing with a chair, seated on my hands and knees. And the reason why I'm doing that is A, you might be traveling or you might just want to do this pose right now, sitting in front of your laptop or computer. Or you might be a person who has certain limitations like knee pain, wrist pain. So these are some modifications that you can do of the same pose. It's also called Marjari Asan, cat and cow, and there are other names for it. Okay. So for this pose, we will be needing a chair if you have one, or if you choose to do the chair variation. And also I have a yoga blanket because obviously I'm a yoga practitioner. But if you don't have a yoga blanket, you can just use a towel or any other blanket that's lying in the house. Okay. You can even use a shawl or whatever you have. So I'm going to start in a chair position. So imagine you're sitting at your desk or your chair, you're seeing me right now. So first we want to feel very comfortable, so we want to listen to our body. We start with comfort and we start with elongating the spine. So for that, you can place a pillow or something behind the chair, or if you feel like you want to just come a little bit forward, so you can feel that elongation of the spine. So we'll take a few seconds to lift the shoulders up and release them down. And this can help with that opening of the shoulders and the spine. Okay. So we'll start in prayer position. Okay. If prayer position does not feel comfortable to you, bring your hands in front. Okay. You have two options. So I'm going to start with the prayer position or Anjali Mudra. So inhale, I'm going to open into a cactus position. So I'm going to push my shoulder blades, right? If you're okay, you can look up. And then exhale, you're going to fold forward. Inhale, open. And exhale, you're going to round your back, fold forward. Let's do that one more time. Inhale. And exhale, fold forward. Good. Last time. And fold forward. Great. Place your hands down. If this feels a lot, I'm going to give you another version because we always have options. Okay. So you're going to take your hands, maybe bring your legs down. You can also place some block or something if your legs are not reaching down. So place your hands on your knees. Inhale as you start to arch your back. Slide your hands away from the knees. Again, maybe look up if that's okay, or look straight. And then exhale, you're going to again bring back the hands towards the knees as you round your back. Good. So inhale, lift up. And exhale, push back. Last time, inhale, lift. And exhale back. Excellent. Good. Okay. So the final version I'm going to show you is on my hands and knees. So you can do this even standing like this, right? So you have that option as well. So for hands and knees, like I said, if you have a blanket, it's good. So we'll use the blanket. If you have bony knees or any kind of knee issues, you can place your knees on the blanket. And what this does, it reduces that shock, it absorbs that shock, or it helps the sensitive knees to feel a relaxation. If you're somebody who has wrist issues, you can do the same thing on your forearms. Okay? So I'll show you them both. So I'm going to come back onto my hands and knees to just notice the weight distribution of your body. Just taking a few seconds to center yourself. Now, same logic, I'm going to slowly start to arch the back. I'm going to open my chest, maybe look up, and then exhale. You're going to round your back and look down. Keep going. Inhale, look up. Exhale, round your back, look down. Let's try on the forearms. Inhale, look up. Very good. And then exhale, look down. Last time, inhale, look up. Exhale, look down. And then slowly release and come. So I've given you a couple of variations and let's understand how that this is helping with chronic pain. So when we talk about our spine, the vertebrae, they have discs in the middle. So you would have heard somebody had a, slip disc or some sort of leakage. You must have heard of those conditions. And if you haven't, that's okay. So these gelatinous discs are shock absorbers. But what happens with this vertebrae or spine that we have is it doesn't really have blood vessels. So how can it get its nutrition? So it can only get its nutrition by a process called imbibition or imbibition. I've heard two versions of that word. And what this does is by movement, that is the reversing of curves. So we're making a convex and concave shape that helps to provide that nutrition. So what we're trying to do is we're trying to plump up those discs. And when you plump up those discs, what happens? It increases the health of that spine or that disc. And when we don't do that, what happens? It becomes stiff and it doesn't get that kind of nutrition. And that's why you might be feeling that stiffness. So when you get up, suddenly you're working, you're like, oh, my back is paining. So that could be the reason. I hope this tutorial was useful. I usually make only short videos, but I do have longer courses and I have longer videos and I also give private sessions. So if you're suffering from a knee injury or a chronic pain issue like say scoliosis or SI joint, then you want a more personalized help. And I usually do that at your own pace. So if you're really not able to move at this point of time, don't worry about it. We can start from wherever you are. You can go to my website, Yoga Therapy with Madhu at www.madhuvidya.com. So I hope you enjoyed this one. And if you did, please share it with someone who is suffering right now with back pain. Please like and subscribe. I'll see you next time. Namaste. Om Tat Sat.